Okay. Our countdown has ended, so our event is going to begin. We're going to start with a video of Hannibal Square Community Land Trust that I'm going to have Kent press play. So we'll ask you guys to each take your seats. Thank you.
My name is Camille Lewis. I am the Executive Director for Hannibal Square Community Land Trust.
Name is Juan Hollingsworth. I'm the current board president of Hannibal Square Community Land Trust.
My name is Nehemiah Davis. I'm the president of DCM. We're doing the construction management.
This development has been a labor of love for myself and I'm sure for the staff and the board. So now we're just really excited and looking forward to the project moving forward, to having homes on this site.
My top goal for this project will be to move some people out of renting into home ownership.
My name is LaRon Frazier. I'd like to welcome you to Hannibal Square. I own FPC Construction. I'm also a part of DCM.
My name is Keston White-Marin. I am the project manager with Davis Consulting and Management.
My name is Jeffrey Beauvoir. I'm a general contractor here on this project. As far as my goals is I want to finish this project on a timely manner.
So what we would like to see happen is, again, more affordable housing in the communities that need them, especially the underserved Black communities.
Well, our goal is to keep the project timely, keep down on unforeseen circumstances, which does happen in construction. But we specialize in this. This is what we do. So we came down way from Miami, and I can't wait to see it to its end.
My background and my introduction to the organization was I was actually a homeowner with the organization before I became a board member. So I know the benefits of this particular organization and how it can benefit families to provide sustainable housing. So me and my wife are thankful of being, former homeowners, and now we can hopefully pass that forward.
All right, thanks, Kent, and thank you, everybody. Allow me to introduce myself. My name is Gigi Mormon. I am a former board member for Hannibal Square Community Land Trust. I was on the board for over 3 years, almost 4, and saw the significant growth that took place because of the commitment of people in this room and the supporters that we have. And I'm excited that today is the 5th annual Juneteenth celebration for Hannibal Square Community Land Trust. So I definitely think that deserves a round of applause for the Hannibal team. For those of you that are not familiar with Hannibal Square, the mission is simple: develop, rehab, and preserve permanently affordable housing for low to moderate income families, promote financial education, economic inclusion, and neighborhood stability. Through the land trust model, we're able to ensure that the affordable housing is in perpetuity. Now, the importance of that is that there are other models for affordable housing, but our homes are permanently affordable so that the next family that comes along will still be able to, it'll still be in their price range versus some other models where the home becomes market rate and now it's no longer affordable. So I really applaud what the land trust model is doing. Hannibal Square Community Land Trust started here in Winter Park in 2004 with single family homes in a historic Black community. And as you saw in the video that was just played, we're proud to be expanding the work that we're doing into other communities, most notably our Orange Center Boulevard project. At your table, there are pictures of residents who have purchased townhomes in the Orange Center Boulevard project. And so we want to share with you just a couple of the testimonies, or kind of like a brief synopsis of who are the people that are being impacted by the affordable housing project that we have going on here. So Chantel Scott, single mom, 3 kids, grew up in Orange Center. Now she gets to come and stay in our center as a homeowner and raise her children there. You know, it's amazing that somebody can come back and do that. You know, Hilda says she's a mom of 2. She lives across the street from the project, so she's watching it build every day. She's seeing it go from the excavation of the land to now bricks are going up, and then she's actually going to know that one of those is being created for her family. So we love stories like Hilda. Addie Smith says that the land trust made it affordable for her to become a first-time home buyer. As a real estate broker, I know the challenges that are out there for people to become first-time home buyers. And the land trust is making it possible for someone like Addie to be able to buy a house. Tori is a teacher. She's a teacher in this community. She teaches at Orange Center Elementary. On her salary, she can't afford to buy market rate. But because of the land trust model and because of what Hannibal is doing, she's going to be a homeowner over the next year. And then Ken says, during COVID, everything went up. As we know, all the prices were just exorbitant, pushed him right out of the market. So many first-time home buyers that were trying to purchase when the interest rate was 3% got knocked out because everything went up in price. Our median home price right now is about $379,000. We need to do better, and Hannibal Square is one of those organizations that's doing better. So we definitely want to make sure that you guys have a connection to the homeowners that we are working with. We want to say thank you to sponsors like City National Bank, who has been here with Hannibal Trust for several years now. They've hosted this event for a couple of different years, and those types of banking partners are helping us to get the lending and the financing for the homeowners to be able to purchase the house and for us to be able to build those communities that we're building. So thank you to City National Bank. I know I saw Ramon. If anyone else is here from City National Bank, feel free to say hello so we can recognize you. But definitely thank you for your contribution. We are also, I know I missed that slide. One of the slides that went up is our new project. Kent's going to bring it back. So this is the Cornerstone at 6th. It's a project in Apopka where we are building, I believe, 24 new townhomes, 3 bedrooms, 2 baths. Rebecca, tell me if I'm wrong. I think 24, right? 24 townhomes in Apopka? So 24 new families are going to get to purchase a townhome because of what the Land Trust is doing. And a lot of blood, sweat, and tears goes into making these projects work. And as far as I know, there are still some homes available. So if you know someone that's looking for a brand new 3-bedroom, 2-car garage townhome, then make sure that they are aware of the Hannibal Square Community Land Trust program. We also want to recognize some of our elected officials that are in the room because the work that they do with helping us with legislation is things that are making the Hannibal Trust or the Land Trust model possible. So we definitely want to acknowledge our mayor. Our mayor from City Park, Winter Park is here, so thank you so much, Mayor Phil. We also have our commissioner from Winter Park, Ms. Sheila DeCiccio, is here. We have staff members from Congressman Maxwell Frost's office, including Sarah El Badri, the Deputy District Director. So Sarah, thank you so much for coming out tonight. Thank you, Sarah. Are there any other elected officials in the room that we need to make sure that we recognize? That's right, I'm sorry. Commissioner Emily Bonilla, her assistant Alicia Caldron-Walker is here. Thank you, Alicia, for coming out. And she is new to Commissioner Bonilla's office, so it's a great opportunity for her to come out tonight and learn about this land trust model. We also want to thank everyone who's worked with the land trust because the sponsorship dollars, the bridge building that you're doing is helping to move the needle in this affordable housing crisis. In the back of the room, you have one of our board members, Jerry Breckenridge. He's back there to talk to anyone who is interested in sponsoring or partnering with the land trust. At your tables, there's a QR code for you to make a personal donation. I make sure that I donate every year because I try to make sure Camille knows I'm still supporting you guys, although I'm not a board member. I'm now out there advocating every time I talk to someone about why the land trust model is so necessary in our community. It's a national model. Let's adopt more of it here so that we can get more people into home ownership. So now we're going to introduce our panelists. And tonight's discussion is race, housing, and health. So it's how those 3 dynamics are factoring into housing and how things that we don't even think, like food disparity and the lack of food instability, are impacting housing, impacting your health. So our planners tonight, or our panelists tonight, are really going to take us through how those three things come together. So our first panelist is an experienced urban planner with a career emphasis on health and equity planning. She has many urban design interests that include healthy housing, long-range planning, multimodal transportation, and placemaking. Please welcome Daphne Green. Our next panelist is a family physician who serves a population of Medicare and Medicaid patients here locally and volunteers at Shepherd's Hope, which is a free clinic that provides healthcare services to uninsured patients in Orlando. Please help us welcome Dr. Rodrigo Pereira. Our next panelist will actually be leading tonight's discussion. She has an extensive background in housing and healthy community design and is also an educator who now works as the advisor on homelessness and social services to our Orlando Mayor, Buddy Dyer. Please welcome Lisa Portelli. Our next panelist is a passionate advocate for social justice who believes that access to healthy food is a basic human right, and we agree. He is the executive director of Hebney Nutrition Consultants. Please join us, Glenn Providence. Last but not least, our final panelist was recognized by the Orlando Magic as a social justice game changer. She is the CEO of Central Florida Commission on Homelessness and the Homelessness Services Network of Central Florida. Please welcome Martha Array. Now that all of our panelists are in place, if you'd like to pose a question throughout the night, we're using Poll Everywhere. And so what you would do is text to the number 22333, text Hannibal Square 132. So if you want to take a picture of the screen right now so you remember what you can text and which number you text it to, 22333 is the text number, and you're going to be texting them Hannibal Square 132. You can pose your question to the group, and after the panel discussion, we're going to present those questions to the panelists. At this point, I'm going to turn it over to Lisa, who's going to give us some context to this discussion with some statistics.
Thank you. And thank you. It's an honor to be here tonight and to begin the commemorations of Juneteenth and to all be together. I did work at the Winter Park Health Foundation for 16 years, and in that capacity worked in the town of Eatonville for a significant portion of that, and then the remainder of my career in housing and homelessness. So being asked to be on this panel tonight was a huge honor and sort of felt like bringing my work together. But you know, I read an article recently, too, on why Juneteenth is especially important to white people. I thought that was an attention-grabbing headline. And especially now, too, I really liked these words. That means confronting the truth that this nation's promise of liberty took a long time to be realized and are still a day-to-day challenge for our world. And I appreciated that perspective, and it's a very important holiday to commemorate. So honored to be here. But on that policy that passed, you know, the Emancipation Proclamation, I'd like to tell a quick story to get us started tonight. I worked in the workforce centers during the implementation of welfare reform. And at that time when we were reforming welfare, it was very controversial. It was a national policy that was going to change a very important safety net for our community and require work of everyone that received the check. So we had 300 staff in the 5-county area. I oversaw those offices. Everyone who went to the Department of Children and Families to register to get a welfare check, I'm using very simple terms here, but had to also then go to what were then called the Jobs and Benefits offices. Remember the Department of Labor? They had to go over there to register for work as a component of receiving that check. And our case managers were in those offices. Those case managers had access to a lot of resources: transportation, daycare, tuition reimbursement. There was a lot of things that we could hand out. And I was in our administrative office one day, and one of the case managers came in from their office out in Lake County and said, "I need to talk to you." You know, as if I controlled this federal law and this policy. "I need to talk to you." She said, "I've got a woman with 5 children. She should be home with those children. I can't believe we're going to, require her to go to work. And I'm here to get bus passes for her. She was really opposed to this. And I said, I can't change that. I, as a mom, can completely agree with you, but in order to continue to receiving her check, which is going to subsidize the pay that she's not going to earn enough at Burger King, so she's still going to get a partial check, we've got to do this. Off she goes, not happy. A month later, I saw her. And I said, how are you? She goes, I'm actually fine. And I said, really? And I said, tell me about your client. And she said, she lives in one of the, we called them at the time housing projects. I know we have a much better term for them now, but she lived in one of the housing projects down, and she finished work one day, and she was coming up the steps of her, the housing project in her brightly colored Burger King hat and uniform, and she heard her 6-year-old daughter say to her friend, my mommy went to work today. And she was proud of her. And that was the interesting piece for that mom and for that case manager, that in the mess of all of this policy and trying to move things forward, there was a culture that we were trying to change too, a culture towards seeing work in, for the next generation. And I just always really appreciated that story in terms of how policy can be so messy, but it can get us there. So on that, I am going to show you a few slides, some data that for some of us, like Glenn, has been around for a very long time. But what the Robert Wood Johnson Foundation and the CDC have done is they have taken, in many cases, taken this data and placed zip codes. This is zip code level or city level or even census tract level data, and placed it side by side so that you look, this truly to me is the intersection of race, housing, and health, or in many cases, the intersection of the pockets of poverty and housing and health and what can happen. Because if you look at this first slide and look at high blood pressure among adults greater than age 18, and you look at that number in the US, it's 32%. If you look at Winter Park, it's 30%. And when you look at Eatonville, it's 45%. Those two communities butt right up next to each other, side by side. Where do we get these tremendous health disparities for two communities that, in large part, too, have some access, but not a lot of access? So I'll keep going. The diabetes rates is what we particularly studied when we were at the Healthy Central Florida and the Healthy Eatonville Team initiative, and we really looked at that diabetes rate in Eatonville at our local data that was done more specifically than the methodology you're looking at here. The diabetes rate in Eatonville was actually 26%. So it was very, very high compared to, and you can see US there 11%, Winter Park 8.9. We dug into that with focus groups. Why is that diabetes rate so high? And learned that there was a culture there of people who had become ashamed of their illness and were not sharing it with friends and family members. People were not willing to talk about it and were not willing to go out and get help. So we opened the Healthy Eatonville place and brought that. We made a lot of change and things were moving forward, but it's an important piece. And then you can look at the obesity rates also for the US population, the Winter Park population, and the Eatonville population. Next slide. I'm going to run through the rest. There's just two more, not a ton of data tonight. It's kind of a lot to absorb. But look at the difference there in, this is a health prevention measure, and look at the lack of health insurance rates at 46% in Eatonville, and then Winter Park, and then the US. Now, I give these data a little bit of pause because they are using, for a town, especially as small as Eatonville, they're using a methodology that estimates it at some level, and I believe that number is a little bit lower than the 46%, but still, even with a margin of error of 5%, the differences are huge in that disparity. This last one, though, and I think there are other examples where the disparity flips, and look at binge drinking for the US population and the Winter Park population, but much lower in the Eatonville community. And I think that's a different conversation for tonight too. And then you look at our the smoking rates in Winter Park as compared to Eatonville, two communities again that sit side by side. And then no leisure time activity. That one I think to me is the easiest to explain. in that people who are working 2 jobs, 3 jobs, and have lack of access to transportation have a lot less time for leisure time activities. So it's just another, I just wanted to kick us off with sort of that disparity in that intersection. There are some real successes in there, and I maybe should have made another slide and put them up there. The cholesterol rates, mammography screenings are equal across the board. Clearly, we've made some health prevention measures in the town of Eatonville where mammography use is the same, cervical cancer screenings are high, fecal tests and colonoscopy rates are high. So we're getting some successes, at least in their prevention measures. So I am now going to actually turn it over to our panelists, or ask some questions, starting with Daphne, who I have to put my little sheet on and make sure I'm looking the right way to my right and my left. Thank you for being here, Daphne. I'm going to throw this question at you. And let you get us going on that. How does housing impact health as a social determinant of health?
Thank you so much. Okay. Thank you so much. I definitely want to give thanks and appreciation to Hannibal Square for inviting me to this, and starting off on a good and fair question to be asking, because housing, I think, is really one of the most intimate social determinants of health, because this is the space where people wake up and they get ready for their days, where they come home after a long day and they recharge after everything that they've gone through in the outside world. It's where your daily activities unfold. It's really where you make your lifestyle choices. So if you have healthy housing that helps to make it easy to make the healthy decisions in life, then you're going to lead a healthier life. You're going to have healthier outcomes. And I feel like when COVID-19 was going on and we had the pandemic and we were going through the shutdowns, it became more clear to everyone the connection between health and housing. But we've known as a planner, we've known for some time, really as a planner, your job is to protect the public health, safety, and welfare. So that connection has always been there. But I think COVID kind of woke us up to that, because we were going through lockdowns, we were experiencing something we had never experienced before. And if you were living in a community where you were able to go out and enjoy green space, enjoy parks, if you were in a community that had your doctor's office that was close to you and good grocery stores that were close to you, you were able to make easier, healthy decisions. And if your housing itself is good quality housing, it's strong housing, healthy, free from mold and pests and things of that nature, then your health is going to reflect on that. But because of the way many communities in our society have formed over the years, especially in Florida, I would say, because of the way that we've developed, our housing is really segregated by race. Predatory lending in the past, as well as redlining, things such as white flight, these things have led to a segregation of housing by race, by income. And unfortunately, if you are a lower income individual, you're more likely to have poor housing. And because minority groups were more likely to have lower incomes and be in proximity to poor quality schools, their job outlook reflected that, their incomes reflected that. They were more likely to be in housing that they had to choose. They had to be in the more affordable housing options due to not just private sector decisions, but also public sector decisions at all levels. So in our society today, we see that there's a separation. I spent time in Tallahassee. That's where I went to school at FSU, and literally the tracks between FSU and FAMU. I remember working in a community in the southern part of the community. It's called the Bond neighborhood, and they experienced a lot of issues. You know, the quality schools weren't very good. They didn't have good grocery stores nearby them. The parks had issues with crime. You know, if they felt safe enough to walk outside, they probably saw littering. It had a huge dumping issue. People would come and do illegal dumping and so forth. And these kind of communities, they are, you know, their ability to make the healthier choice, it's restricted. So they end up usually dealing with making the choices that they can in the community where they're living, and it's just not the best quality. So their health is reflecting that. So this impacts their mental health, obviously. You know, we in our society, we see our housing as a reflection of ourselves. So this creates an impact on not just your health, your physical health, but also your mental health. So these communities, they are experiencing disinvestment over the years. They're not able to have the human or social or political capital to fight for their needs and to fight for those improvements that will make their communities better and will provide them with better health. And they're probably seeing other communities, enjoying those investments. They have the income and the home ownership opportunities and the ability to put into the tax revenue so that they can, improve their neighborhoods over time. And it's different for those more marginalized communities. So, that's impacting their mental health also, as well as their physical health. So I think that when we're thinking about how housing impacts health, it's not just the physical, it's also the mental component that we need to consider.
Those are some really wonderful points. Thank you. It's actually a perfect lead into Dr. Pereira. I'm going to ask you, how do housing issues such as a lack of access to safe and affordable housing impact the health of individuals, particularly those with pre-existing medical conditions?
So many ways. So I think the first one to talk about would be, for example, just the instability. You don't know what's going to happen tomorrow. You don't know if you're going to have a house tomorrow. We know that from the physiopathological standpoint, you have a rise in your cortisol level, that increases your blood pressure, that increases your cholesterol, your blood sugar, so that can not only cause disease, but make diseases harder to control. We also see sometimes just the quality of the houses. For example, if you have a house that has mold, that can affect how often somebody with asthma will have an exacerbation, how often somebody with COPD will get sick and eventually have pneumonia and end up in the hospital. We saw that with COVID as well, like overcrowding. Too many people living in the house, the whole family gets sick at the same time. And also just the stress of, not the stress, but like the cost when you're spending most of your time, or for money with your housing, you don't have money to spend in your health, you don't have money to spend buying nutritious food. So it affects the whole idea of getting sick in all different ways.
Thank you. Thank you. The majority of people in Orange County can spend up to 60% of their gross income on housing, so that's significantly going to impact your ability to spend on other things. And a quick comment on Daphne's comment, too, about during the pandemic. We saw a lot of people, if you couldn't afford the increased cost of the groceries in having them delivered, you were one of the people who then had to put yourself at further health risk going into the grocery store. So there, those who had those resources could have food delivered and then possibly eat better. So many people were so afraid to go into the grocery store. I think sometimes we'd all rather forget about that pandemic, but there were a lot of lessons learned too about access during that time. So Glenn, I'm going to turn to you, my friend. Can you discuss the role farmers markets and community gardens play in underserved and under-resourced areas?
Good evening, everybody. It's good to be here, and it's a complex issue. I think Daphne was talking about the role that urban planning and just how communities have changed over the years. When I first moved to Orlando in 2006, Orlando today isn't the same Orlando we knew from back when, from all the changes that has happened in the last just 15, 20 years that I've been here. I like to say that in the United States, we don't have a food resource problem. We have a distribution problem and how food is allocated, and there's a disproportionate, and there's layers, and you mentioned redlining and all the different impacts that segregation of how we live has affected the food system in America. So I'm sure most of you, if not all of you, have heard about food deserts and the role that food deserts play. And if you can rewind back the VCR, you guys are old enough to remember VCRs. If you can rewind back to VCR in many of these communities, and it's funny for me, again, only being here for a relatively short amount of time, talking to people who are lifelong residents of Orlando, and they would tell you, I remember when a Publix used to be here, when a Winn-Dixie used to be here, and you fast forward, and now those stores are not there anymore. And it creates these food deserts, and then what is left is these smaller mom and pop stores that are left to try to fill the gap, if you will, for these neighborhoods. These mom and pop stores are small businesses with a focus on their bottom line. So if produce has a short shelf life, and so if as a store owner who, and in many cases really have no vested interest in the communities, they may have had an opportunity to purchase a store and see dollar signs. So there is no vested interest. And so why would I carry apples and bananas and cabbage and lettuce that can go bad in 3-4 days, where I can have more shelf-stable, high sodium, no nutritional value types foods, chips, and all unhealthy snacks, but again, that can drive more income to their stores. That's their focus. So it all plays a role. And so farmers markets, all of that to say that farmers markets, my organization operates a mobile farmers market where we go and meet people where they are, invest in farmers markets, invest in corner fruit stands, anything that can get CSA, community supported agriculture type projects, because they do make an impact. When people have access and they know better, they do better, but you start layering transportation and of course financial, and the further away you are from those areas, you know, within a food desert, the harder it becomes to make those changes. So it's a definite connection, and so we work daily to try to alleviate some of these issues.
Thank you, thank you. And bringing up the convenience stores, that is as equally important of an issue, to understand the role that food stamps play for many people that have access to those. Any store that is accepting food stamps, and many of them do, are supposed to provide 4 things: a protein, fresh fruits and vegetables, dairy, and grain. Thank you. I was like, I could remember. And yet many of those just meet the letter of the law through a freezer case full of a few things, and there's really no access. And yet that is the closest store. I've got 2 kids. I'm trying to get home. That is where many people shop, and then they end up purchasing, you know, the junk or the cheapest stuff or the things, whatever they can get there. So it really can be a huge issue with food stamps. And we were involved in, we worked together for a long time, involved in some discussions about, and it's a controversial issue, requiring the use of healthy food, the purchase of healthy foods, and banning the purchase. And I want to give people the dignity to buy and eat what they want, of course, but if we require the purchase, or what they've done at the farmers market, and Ebony did this through their mobile farmers market, they offered incentives for the purchase of fruits and vegetables, so it was 2 for $1. It was like a BOGO if you were using your food stamps to purchase fruits and vegetables. And that's important in the convenience store market too, because it creates that demand. So then that store owner is going to stock the fruits and vegetables, because now he's got the customer coming in. So our food stamp customer, our federal government, through those food stamps, is a major buyer of food that really drives that demand, and we've got to keep pushing for that demand and that access too. So thank you, Glenn. Where was I? Martha. Martha R. is, they said it, the Executive Director of the Homeless Services Network. So as the city's advisor on mayor, to the mayor for homelessness, we work together every day. She is a friend. And I just want to add to it, in introducing her tonight, that organization under her leadership brought a record $12 million in funding to our community last year from HUD. That's a big deal. And I'm not done. We got a youth grant, 6.7 million. 8.4. I knew I was close. I knew she'd correct me. I didn't have it in my notes. We got a record. We had an $8.4 million grant that can help us end youth homelessness. And that is a sustaining grant that can continue to support the efforts. So not one of those one and done things. And she recently found out today that it is in our state budget to receive the $1 million match that our community needs. And the governor did not veto that. So we're going forward with another $1 million. So I just pause that. Yeah, when we're making changes, So thanks, Martha, for that. So Martha, but what can we learn about race equity from the homeless data that's captured across our community? I know you're the hub of all of that data, so please.
It's a good question. We do capture a lot of data. And first, I just want to say I really appreciate the opportunity to be here today, and I appreciate the work that, that the Land Trust does. And there is such a connection between that work and homelessness. The number one predictor of homelessness has to do with what your rent is, what the rent market is. It is the number one predictor of how many people in your community will become homeless. And one of the challenges with the rental market is it remains super tight when there are not first-time home buyer opportunities for people to get out of renters and become homeowners. Then more people stay renters. That creates a downward pressure. And one of the consequences of that is more people become homeless. And so just the work to help create opportunities for first-time home buyers is near and dear and such great work. So thank you. Thank you for that work, and thank you for what you do. What we know, a couple of things that we learn from the data about our homeless population. So you may know that the black population in we're a tri-county organization, so Orange, Osceola, and Seminole counties is around 17 to 18% of the population. But of persons who live in poverty, the black population makes up about 24% of persons who live in poverty. Of the homeless, of people who experience homelessness, more than half are black. So 17 to 18% of the population, but more than half of our homeless population, which is frightening and horrifying, and it's very hard to be able to name anything other than systemic racism that could play a role to create that large of a discrepancy. So that's one of the things. Another thing related to this conversation that the data tells us is that if you have a disability, physical, mental health, substance use, some kind of a disability, HIV positive, things like that. If you have a disability and you become homeless, you are much more likely to remain homeless for extended periods of time, much more likely to die on the streets, and much less likely to be able to end your homelessness without intervention from other folks. If you do not have a disability, you are much more likely to be able to self-resolve. Doesn't mean that help isn't good, but even if nobody helps you, you are much more likely to be able to end your homelessness. I know that our community is not okay with the notion that if you have disabilities, you can sleep outside. But that's what we have because of our housing market at this time. And people of color, especially persons who are black, are significantly disproportionately impacted by that.
Thank you, Martha. Thank you. I really liked her first comments too. We know that since 2019, the average rental increase in Central Florida is about $500 a month. We've had a significant increase in rents, and right now we've had in Orange County a 40% increase in our unsheltered population since 2019 also. So we're seeing that increase. And it's just everyone always wants to analyze it so much into the mental health and the substance abuse and all these other issues, but just the reality is it's the rent, it's the housing. The difference between the housed and the unhoused are the people who can no longer afford that rent. It's actually less than 0.005% of a population that experiences homelessness on any given day. In this area, that's about 2,300 people on any given day. But if you look to our housed population, they have all of those same challenges, but they're just simply in a house. So Martha and the Commission on Homelessness have led our community in an effort to become a housing first community, which means we're just working hard to shorten that length of shelter stay and get you back stable and get you back in a home that everyone just deserves. And then, yes, if we have the dollars and we try to provide some wraparound services to that to support you back in that home. But we're just trying to get people back in a home because that's really the only difference. So thank you, Martha. I am going to slide back to you, Daphne. We have some elected officials in the office, so I really like this question. How can local governments improve the inequitable health and housing conditions that exist in their communities?
Yes, this is a good question. I would say, first off, continue to partner with groups and agencies like the Hannibal Community Land Trust. I think that a lot of local governments, the way that they are set up, don't always have the housing expertise in-house. Usually not even like a housing department or someone who thinks about healthy housing. Usually it's just like community development. That's the type of department that you'll see at a local government. So I think that making sure that you have partnerships with nonprofits, partnerships like setting up public-private partnerships with those who can help with leveraging funding that can be used to develop affordable housing. Affordable housing projects require a lot of funding leveraging. So if you can make sure that you have those partnerships in line that can facilitate those projects and lead to that housing development, that would be really, really good because we have a supply issue at the moment. There's just not enough housing to meet the demand that we're seeing. A lot of people are moving here every day. And so the need to work with others and make friends and make partnerships that can lead to the steady increase of more housing development is what is helpful. And also looking at your policy framework as a local government, looking at your comprehensive plans and your land development regulations and making sure that they're supportive of affordable housing. Do you have affordable housing defined in your policy framework? Do you have middle housing, the type of housing that we need more of? Do you have that defined somewhere? Do your policies support inclusionary housing? Things of that nature. I think a lot of governments are needing to increase the amount of density that can be developed within their communities in order to facilitate more multifamily housing and that missing middle housing and so forth that's needed because right now housing is it's a little bit more expensive than what people are able to pay. As we've spoken before, the prices of everything have increased. So I think looking at your policies to make sure that they support affordable housing it's very much so key. The Live Local Act is something that's recently been passed in the state. I think that one thing it supports is thinking about how you manage your surplus lands. There's a lot of land in our communities, I think, that are vacant and can be looked at a little bit more if it's owned by the city or county. You can look at that and think about how it can be used for affordable housing. And also look at your programming. Think of how your programs are supporting the protection of those who rent. Do you have any tenant protections set up? Yes, the Live Local Act that I mentioned does kind of ban rent control, but it does not ban tenant protections. It does not ban eviction protections and so forth. So you can think about developing a tenant bill of rights and so forth that can help to protect our tenants, those who rent during those times of steady rent increases, because they're the ones who are experiencing housing instability, and which is creating that stress, which is creating a bad impact on their health. So you want to think about that and make sure that your policy frameworks are supportive of affordable housing.
Would you mind elaborating on inclusionary zoning? Because I'm just thinking there's some people in the audience who might not know what that is.
Inclusionary zoning is the system where when you're having development that's being proposed, it creates a way for providing incentives to that developer if they develop more affordable housing alongside that development.
Yeah, works. And another model I saw is that where a county required any developer who was building any kind of for sale or rental apartments had to have an element of affordability into that complex, or pay dollars toward a different complex if it was completely inappropriate for that site or otherwise. But it really, as we get worse and worse into this crisis of affordable housing, things like that need to be looked at, and how can we sort of require that inclusion for all. So, Dr. Piero, as a healthcare provider, how can we best support patients who are experiencing housing-related health issues, unstable housing, housing insecurity, unsafe living conditions? What resources are available to help patients? I think this is interesting for you.
I think the first thing, you have to be aware they exist. You have to have a system to screen them in your practice, and to keep screening, because the situation changes pretty quick. In my office, we have that as one of the questions when we have a new patient, and we, at least once a year, maybe we should do more often, but at least once a year we revisit that. We have to be mindful of how the social determinants of health can actually affect some our patients. So I talked about the cortisol, but if you have a desert situation, then you cannot eat healthy foods, your diabetes will get worse. So to be aware of how those things can affect the health of our patients. We have to count on the help of our social workers and case managers. They're pretty much the ones that can guide us to find the right resources for our patients. But just as an example of things we can offer, medication-wise, we can get help with coupons. We can enroll patients on drug assistance programs. As far as finding healthcare when you cannot afford a regular clinic or you don't have health insurance, resources like Shepherd's Hope, where I volunteer, or federally qualified health centers, those are resources we can always tell patients about.
Thank you. I think another example that I've seen is families that are living in pay-by-the-week hotels. They may or may not have refrigeration there in that hotel room, and they're just paying $300 a week. And so if a physician prescribes something that requires refrigeration, or there's just certain medications and things that it's in the homeless population too, but they're for people like taking into consideration where they're living and what they have access to, their ability to stop at a pharmacy and get this today, and those kind of things. So I've seen some physicians do some really unique things, particularly also with the use of samples. Are you still allowed to hand those out, sample medications? And do you do that discriminately to people who need them more? Maybe?
Some offices don't take samples anymore. Oh, okay. So I'm working in a place that we don't take samples, so we don't have samples to give. But like in the other jobs I had, samples were something we would, every time we would receive a sample, we had a patient already in mind, like this sample is for that patient. But, it's a very good point. Like we have to prescribe what the patient can take. So sometimes if you're thinking of something like insulin and you don't have a refrigerator, like what you're going to do. So, yeah.
Thank you. Glenn, back to you. Can you talk about the connection between housing stability and food access, please?
Yes, I can. Briefly, you, what did you say? You talked about in the...
you expect me to remember that?
I expect you to remember.
10 minutes ago.
Because I had a train of, my thought was, you talked about families living in some of these shelters that don't have refrigeration and
hotel motels.
Yep. And what that led me to think about is there's a whole movement around food as medicine, and these food as medicine initiatives across the country, where doctors are working to prescribe produce prescription programs, of which we actually have one with Shepherd's Hope, to work to, because with food and lack of access to healthy food and culturally diverse food in neighborhoods, where they need it, leads to comorbidities. So now you start talking about diabetes and hypertension, and all related to food, all food-related issues. 1 in 8 people in the United States are food insecure. And your biggest determining factor of your overall health in the United States is where you live. And we need to put an end to that. More black and brown people are living in underinvested, under-resourced neighborhoods where access to healthy, affordable food is key. And if you don't have, you mentioned social determinants of health, and food is one of those. And if you don't have enough money for rent, food comes lower on that totem pole. So if you are a single mom with 2 young kids, and my organization is trying to tell you to cook and get in the kitchen and prepare a healthy meal for your family, but you don't have a grocery store in your neighborhood, and you may have to take a bus and transporting bags of produce with kids or in strollers, and the situation back to a house, versus you could go to a drive-through or walk up to a fast food restaurant. The options for dealing with fast food is the easiest win. So there is definitely a connection there, but pouring more resources into these underserved neighborhoods. There is innovative programs across the country where even in housing developments, they're doing more cooking demonstrations and providing more resources to low-income and marginalized communities to show them the direct impact that eating healthier can have on these communities. And there's a myth, and when we work with the clients that we work with, our neighbors, our community members, that eating healthy is expensive. Eating healthy can be expensive, but through meal planning and other strategies, you can manage to save money and eat healthier at the same time. So the connection is there. We're trying to break the cycle of that going to the doctor and medication by providing these comprehensive nutrition strategies to help that.
And thank you for the work that Ebony does on that. They did a healthy cooking demonstration class in Eatonville. It was a 6-week program on Tuesday nights, filled to capacity, filled to the very end. Everybody graduates, and there's just a real hunger for that information, pardon the pun, if you will. I think I forgot to say this at the start. Where you live is one of the most significant components of your overall health outcomes. Up to 60% of your health is determined solely by your zip code. We can predict that. And do you know that your insurance companies, when they are doing their algorithms to create insurance rates, can look at your gender, your age, and your zip code and determine your health status and just how much risk you might be to provide health insurance for. But they can also be changed without moving. The social and built environment determines your individual health and community health above your personal behavior and clinical care. So changing that culture and coming in and bringing and helping educate people who really don't know and have not been taught that is so important. So thanks for Ebony. Martha, back to you. I believe there are about 60 agencies that are members of the Homeless Services Network. What can that provider network do in response to the data that you talked about?
Another good question. It's important, I think, as the rent market is what determines how many people will become homeless. And so the provider network, the shelters and the street outreach workers and those agencies can't control that inflow into the homeless system. But we do have a responsibility to look really hard at what happens once somebody enters that system. And so I'm very pleased that our network of providers across the 3 counties has, over the past couple of years, has taken that responsibility seriously and is looking at, do we have disparities within who's accessing what kinds of services and what the outcomes of those services are. And that we do have much more control over. And so it's important that we own what we can work with and do our best to try and keep things on target there. And that's been a little bit hard. There's still some stuff that is beyond our control. It's harder to get it can be harder to get people out into housing when their income is very low, and the landlords that accept people with income at that level may have their own biases, and there may not be much that we can do about that. So there's a lot of factors that come into play there. But we've also, Lisa, we've been really successful at incorporating, making sure that we have opportunities and advisory boards and advisory councils of people who are or have experienced homelessness, and using their voices to ask the questions and to get input from them about what do we need to do in changing our programs, how do we need to adapt what we're doing and how we're working with the population of people experiencing homelessness so that we can be as effective as possible, and so that we're not, we're opening our eyes to blind spots, and that we're making sure that we're not unintentionally creating barriers or doing things in a way that has a negative impact on some people and not as much on others. And that's been really something that we've taken much more seriously, I'd say, in like the last 3 or so years, and it's made a phenomenal difference. We can even see it with a large award of the HUD funds that we just got for youth experiencing homelessness. The planning process for that has been seriously led by youth who've been homeless, our 18 to 24-year-olds. And I promise you, the programs that are going to be funded and how they're going to operate would not have looked the same if we had not been listening to that voice. And so I think all of that needs to be in the swimming pool when we're trying to figure out how we're going to help keep people from drowning.
Thank you. I'm going to ask one last question, a little bit of a prerogative of the facilitator here, that any one of the 4 of you could jump on. The commemoration of Juneteenth's always been very important, but the commemoration of it is really only about 3 years old, and as a national holiday and as we move forward. So, why is that recognition and national recognition of Juneteenth important to you? Anyone who wants to grab it?
Too slow. I think that it's very important because
microphone switch.
I think it's important because so often the Black and brown community don't have a good control over the narratives that are shared in our society. So this really is something I didn't know about. I don't think a lot of us knew about it until someone told us about it, because the narrative has always been what it has been because of what the majority does want. And so when we learn about this, we're able to understand our history a little bit better. We're able to provide a narrative for ourselves in a way, and it's really good to know it and to be able to celebrate it as a whole people and to understand how far we've come because of it. So I think that's why it's really special.
She stole my answer. But just to piggyback on what she said, Juneteenth is America. And so what we were taught in school was there was the Emancipation Proclamation, and that was it. Slavery was over. And so it goes to show, and there's so much more, but the struggles the Confederacy and the Union had, and so Juneteenth is truly an American celebration, but it's a Black celebration, but for America to realize the role that slavery had to play in this country. So.
Thank you.
So I'm going to tell a little bit about my experience because I'm not from here. I am from Brazil, so I came here, I was already 30 years old, and I never heard of it until one day
Most of us had not.
I heard of it. And I was like, was that just one of those things that you see all the time and you don't remember? But I was listening to NPR when they start celebrating, and I was like, oh, okay. So, but I think it's important because it's been, we would imagine it's been a long time since the proclamation, and we still have so many things that we need to change. So I think it's good because it reminds us that, you know, we still have a long way to go, and we have a lot of things we need to do.
Yeah, I mean, I think for me it's tied into that, again, as you said, it is an American experience, but it is one of the few opportunities where that American story is being told by people of color, by people who are Black. And that's an underrepresented voice in that conversation so often. And as I said before, we have such a disparate experience within the homeless community with people who are Black being so overrepresented in that population that I similarly don't think we are going to figure out how to prevent that and how to end homelessness unless we have enough opportunities for Black people who are experiencing homelessness to tell the story and to be part of that solution and to be part of figuring it out. And so it's an emulation for me of another story that needs to be told from that voice.
Thank you. Thank you, everyone. We're going to turn it back over.
First, can we give them a round of applause, please, because they were amazing. So I'm sure some of you took some notes while you were listening to the discussion. So some of the depressing news for me was the poverty rates and how the homelessness numbers are more than double or more than half of the numbers are Black. Those are issues that we need to take care of. The rental issue, $500 a month since 2019, that's not a long time ago. Who can afford that $500 extra on top of all the extra charges that are taking place? But I was inspired to hear stories about like our community being a housing first community, that we're working on getting our homeless or unsheltered population back into sustainable and good, healthy housing. So I appreciated the fact that we're doing that and that HEBNY is working to make the food deserts non-existent because that's so important. I love the innovative strategies that Martha was talking about for making sure that we can create additional housing options for people. And I see a lot of work taking place in the Central Florida community in terms of workforce housing, transportation, all of the initiatives that are taking place so that we can have better mobility for the people that live here so that they're not taking 3 hours to get to their workplace because they have to wait an hour for one bus, take another bus on the second round. And who has time to do that after an 8-hour shift? So I think that we're moving in the right direction and that there's a lot of good being seen here. I know that our elected officials in the room right now. We're taking notes. So thank you, Mayor Anderson, for coming out. Commissioner DeCiccio, thank you so much. I know that Sarah's here with Maxwell Frost, Congressman Frost's office, and Alicia is going to take back a lot of information to Commissioner Bonilla. So the conversation that took place, the knowledge that was shared with us tonight is impactful. We received some questions. So I think the one that kind of led into what you had just talked about, or an extension of it, was how can we get city officials to support affordable housing when developers come in and buy up properties that force gentrification and push lower income residents out? When developers' main goal is to profit, how can we make them accountable? So is there anybody at the table that can help to address that question?
You're probably more
Lisa.
versed, but I'll jump in since you hesitated for just a second. I mean, I just think that there are some effective programs that we have to help those developers tap into. The state housing tax credits and local and other things. Those, if they're going to receive those tax credits, it's going to help their bottom line, but it's also going to put an affordability period onto the property. And 30 years ago, that affordability period was only about 20 years. So a lot of the previous tax credit projects are actually expiring, and we're going somewhat backward. So, but they did pass the Sadowski funds this year. They did not rob the trust fund.
Finally.
Last I heard. And they did?
No, finally, they allowed the money to come through.
Yeah, so those
State
are
funding.
those dollars that we have to help, our local government staff, we have to help make sure that our developers are aware of those and that they apply for those projects and bring that down, because that'll lock in the affordability period. So, agreed.
That's a big question. I'm actually working on a project right now. I was actually closing out, but we were looking into our region and looking at how a lot of outside corporations, agencies are coming in and buying up a lot of our property, putting it back on the market as Airbnb, short-term rental, or rental property. So the amount of homeownership opportunities are kind of slowly kind of coming out of everyone's hands, not just like minority groups and vulnerable groups who are needing it. So I feel like we need to work a little bit more with that, because a lot of people do use it for passive income. It is something that can be a benefit to the economy. However, you want to look at your communities and just, I think one thing is tracking affordable housing units that we have in our community already that are about to lose their contracts or kind of sunset, and they're not going to be affordable anymore. So I think tracking those and making sure that they can still remain on the market as affordable, continuing to develop more affordable housing is also key, and kind of working with those landlords to make sure that they are kind of setting up programs to make sure that they have the education and the means to understand this scenario and have the resources available to provide a better, options for the people who rent those housing. So I think that that would be great, and also trying to understand like displacement in the community that might be an outcome of those situations. I think understanding that would also be good.
Absolutely, because there are a lot of families that are one paycheck away from being homeless, unfortunately.
And just one unique example that I know the city of Kissimmee is doing, city of Orlando has done, partner with a developer on a hotel-motel conversion. So we do have some blighted hotel properties. In some cases, those are providing a level of affordable housing to the people who live there, but they're literally paying weekly and can't get ahead of it and can't get solid. So, going in, purchasing those properties, renovating them, putting in full kitchens, full-size refrigerators so people could actually live and stay, can also be a way to remove blight. And in some cases, those are pockets of crime, and it allows you to remove that blight too. So I think, city and county governments can look to those properties, look in those negative eyesores in a community and transition those into studio apartments. The Ambassador Hotel on West Colonial is an example of a property that next year we're going to have 150 studio apartments that will rent at an affordable rate, and 15 of those units will be permanent supportive housing for chronically homeless people with disabilities. So just an example.
Yeah, I love that. And Martha's going to add another point, but that's a great example of inclusive housing, because they're also using like old elementary schools and converting them into housing. So we have to look at the innovative strategies to help us.
Some cities are using office parks, office buildings.
Office parks.
That as everyone moved home, they found empty office space, so they're transitioning it.
And in Washington, D.C., they have subsidized rent for young professionals. So if you make less than $70,000, the government was helping to give them some money so that they can rent from an apartment and start to build their lives. So innovative strategies are important. Martha, you wanted to add on to that?
Yeah, I want to challenge just a little bit, flip it just a little bit, because almost every elected official I know will say, we can't get it zoned. We can't get past the neighborhood opposition. Even if we wanted to put affordable housing there, everybody comes out and protests. So I want to flip it back and say, we need to all become courageous neighbors who stand up and support affordable housing in our own communities. Many times we are talking about creating housing that will be affordable and available to the exact same people who used to live in our neighborhood who had to leave because the rent went up $500. These are not crazy people from Mars that are going to be coming into our neighborhood. These are our own neighbors who have been forced out because rent went up. Yet, when the opportunity to create affordable housing comes up, so many people express fear and displeasure, and many elected officials don't feel like they have the political cover to support the affordable housing. So we have the opportunity and the ability to help change that and to make it, and to give our elected officials more cover so that they can be more assertive in creating those opportunities. So that's really a huge piece. It's huge. It's huge.
It is, and I think most people in this room have heard of NIMBY, not in my backyard. So that is the general expression for people not wanting something to come in their backyard. There is an organization in Orlando called YIMBY, Yes in My Backyard. And this young, I think they're all under 30. When that ambassador project was coming to City Council, we got 150 letters of support for that project. So there is go join YIMBY or become part of that group that speaks in favor. And I think another piece too is a lot of times the people who don't want affordable housing don't realize that they're living right next to an apartment complex that is a tax credit complex, and it's a percentage of the people that are there that are receiving the affordable units, and they blend right into a neighborhood so well. So we need that education.
I had a friend who would go to, when he lived in a community that tried to do several different kind of group homes and transitional housing and things like that. And every time it came up, he would go to the city council and he'd say, I want them all. I want all of them in my neighborhood because we've got one already and they're my best neighbors. They keep their grass cut shorter than anybody else does. Every time my kids are selling chocolate candy bars, they buy more than anybody else does. They decorate it how, they are my best neighbors. Bring them all. And that's a powerful support for affordable housing.
I love that. Courageous neighbors, everybody. If you walk away from anything tonight, make sure that that's one of them, because these are our neighbors and we have to help our community to grow. Another question that came from the audience: what specific initiatives or strategies are being implemented to address the intersection of housing and social determinants of health and improve? So do we have any that we can share with our audience? Martha, what do you got? Daphne? Glenn?
I mean, I know that the big hospital systems are engaging in conversations about that and research on that, and are trying to come up with ways that they can step into that space because it ends up having such an impact on their bottom line. We know that several years ago, Advent Health invested $6 million into the homeless system because they knew that people experiencing homelessness, particularly those with disabilities, cost them a lot of money. And it cost more to have a disabled person on the streets than it does to pay to put them in housing and to give them the services that they need. And so as we make that kind of research known and that kind of information available, we have more healthcare providers who are kind of stepping into that space. We see it with Medicaid, starting to create some Medicaid pilot projects that support ways to get people into and keep people into housing, but we could use more of that support.
And I'll do a plug for a local organization, Rebuilding Together Orlando has a Healthy Homes initiative where they've gone into communities with, and assessed homes for literally the physical challenges when you have mold or other things, and gone in and helped people make their physical structures that they are living in healthier. So that's one specific strategy that I know is out there, very targeted to the physical structure.
And knowledge is power. So getting the messaging out there about different programs that are available for our community citizens to utilize is huge. There are programs through City of Orlando that will help residents to fix part of their home that will make it healthier for them. So it's really about knowledge. Knowledge is power. We have to continue to have conversations like this so that we spread that information out to everyone. I'll touch on one last question for the night. Not sure if anybody has the answer, but I thought it was a good way to end the night. Could you touch on workforce programs at OCPS, education and certification programs that can be the path out of poverty? So we talked about Medicaid at one point requiring that people have a job. What are we doing to make sure that more technical schools are being afforded to our community members so that they can help give themselves that leg up, especially in the stage of technology that we're in now?
I would like to plug, and I have no connection to them, but shameless plug, I do publish a newspaper. And I did a story on Valencia College and the work that they've done. I know especially in Pine Hills in creating a program that does everything from forklift operator training to welding to anything. And these are, opportunities that 20 years ago weren't coveted positions, but now you're seeing a resurgence on these trade schools. So Orange Technical, Orange Technical College, which is a part of OCPS, they're actually building a new campus in Ocoee for that very same reason, because they're seeing the demand for these types of careers and how they can, these are more than living wage positions where they're paying you 20, 30, in some cases $50 an hour. So I think you're seeing a return back to some of these opportunities. So definitely support those.
Thank you, Glenn.
And I'll be brief because I know, like, at this point, we're between you and your last round by the buffet table and the cocktail bar over there. So, but yes, Valencia College, those specific skills classes that they have, they actually have, most of them they can make available for free for people who are experiencing homelessness.
Yeah. Good partner. Any last final thoughts?
I did want to have one little tidbit in. So at our Regional Planning Council, we have a brownfield program. It's a regional brownfield program. And it's made up of coalition cities. And one of our coalition cities is the city of Kissimmee. And they recently got a workforce training grant. And through that, they are able to train those in their community to be a part of the brownfield redevelopment process. It trains them to be those who go out and to assess the properties that are perceived as brownfields and assess the soil, assess the water, and so forth. So it's a way of training them to provide them with jobs. So that's one of the programs that I'm familiar with, and I think it's really great about providing that training and a pathway to a career that I don't think many are aware of.
Thank you.
And also improves the health of the community because brownfield redevelopment.
You hit on it, pathway. A pathway to the future. Exactly. The same way that Hannibal is creating a pathway to home ownership, we have to make sure that there are other pathways that are being created towards healthier living and more sustainable living. So Thank you guys so much for coming out tonight and sharing your wisdom and knowledge with us. We truly appreciate it. And just as a final acknowledgement, I want to ask the Hannibal Square Community Land Trust Board to please stand up so that you know who they are tonight so that you can mix and mingle with them. I see Juan in the back. Rebecca, yes, Jerry, Kent, and Camille, our executive director, is here somewhere. She's around the corner. Camille and Kent and the whole team, Samantha, I believe, is on this side. They really worked hard to make this, happen and bring it together. So thank you guys so much. Camille Reynolds, Reynolds Lewis, if you don't know her, make sure that you find her. She tries to be shy, but she's a workforce horse that just really makes things happen. Thank you guys for coming out tonight. It was a pleasure to MC the event, and you guys were fabulous. So please go have some food, take some pictures, have some drinks, and enjoy the rest of the night. We shut down, I think, about 8:30.